Okay, so now I ask Dr. Anna Facchini, a research fellow of the Burlo Garofalo, to come to make her presentation. She will talk about phenotypical overlap reflecting common biological pathways. Again, you have 20 to 25 minutes for your presentation, so that can be questions.
Thank you. Well, thank you. Thank you for the presentation. It's a pleasure to be once again here at the conference to present my work. So thank you to the organization as well. Today I'm going to introduce a comparative work on White Satin syndrome and CHAMP1 related syndrome to investigate and eventually highlight the phenotypical overlap of the two syndromes, which might be a reflection of a common biological pathway and pathogenetic pathway of the two syndromes. So I'm going to talk very briefly about the two disorders separately, and then we'll do just a little bit of an overview of the functioning of CHAMP1 and POGZ and their interactions. And then I'll briefly expose some very first results from a phenotypical comparative work that was made possible also with, thanks to collaboration with Professor Zollino from Gemelli Hospital of Rome. So let's start with the CHAMP1 disorder. That's a very rare neurodevelopmental disorder caused by pathogenic mutation in CHAMP1 gene, which is a very important gene for neurogenesis through different cellular functioning, like mitotic progression, chromatin modulation, and DNA damage repair, as we'll see very shortly. Pathogenic variants in CHAMP1 that then leads to CHAMP1 syndrome usually occur with a de novo mechanism. And as we said, CHAMP1 syndrome is mainly a neurodevelopmental disorder. So the hallmark of the syndrome is neurodevelopmental delay, often associated with a set of behavioral disorders. The neurodevelopmental delay can include intellectual disability and language or speech impairment, motor delay, often with unsteady gait. And as for behavior, we have often autism spectrum disorders, but also hyperactivity and attention disorders, repetitive behavior, and sleep disorders. The syndrome also extends to neurology with hypotonia and epilepsy very often. And then aside from the neurodevelopment, CHAMP1 syndrome also shows with very characteristics dysmorphic traits of the face, but also hands and foot, as Professor Zollino just showed, but also often with microcephaly, short stature, optical defect, as strabismus or refraction defect, and often gastrointestinal issues like feeding difficulties and cyclic vomiting. On the other hand, we have White Satin syndrome, which is, again, another very rare neurodevelopmental disorder, in that case caused by pathogenic mutation in POGZ gene, which, again, is a gene that encodes for nuclear zinc finger proteins involved in very similar cellular function, especially during neural differentiation and brain growth. And in that case too, the syndrome is mainly caused by pathogenic variants that occur with a de novo mechanism, although there are several White Satin syndrome families described worldwide. Not surprisingly, in that case too, the neurodevelopment and behavior aspects are the main characteristic of the syndrome. So again, we have a global developmental delay with intellectual disability, language impairment, and motor delay. Very often we have a picture of behavioral disorder, including autism-like features, ADHD, anxiety, and sleep disorders. And when extended to neurology, we often see hypotonia and history of epilepsy as well. Very similarly to CHAMP1 disorders, white satin syndrome is also characterized by dysmorphic features, microcephaly, overweight, again, ophthalmological defects with refraction defects and strabismus, but also hearing loss, gastrointestinal issues, and mild and often asymptomatic malformation of brain, heart, and kidneys. So now that we've seen and we've outlined the two syndromes separately, let's see how they converge. And starting upstream at the molecular function of CHAMP1 and POGZ, Professor Tanaka before gave an excellent speech on their functioning. So I think my slide would be more of a quick recap of it. I'm gonna focus on this three main function that we've seen before, so chromosome segregation in mitosis, gene expression, DNA damage repair, and I'm going to focus especially in brain development, keeping in mind, however, that both proteins are expressed non-specifically in different tissues throughout the body. So for the CHAMP1 and POGZ functioning in mitosis, we know that both proteins play a key role in cellular division by ensuring kinetochore microtubule attachment and correct chromosome alignment. By doing so, they interact with very similar molecules like the CNP family proteins, but also they interact with the same proteins like MAT2L2 within different mitotic control pathways. As for gene expression, we also know that both CHAMP1 and POGZ localize to heterochromatin, therefore playing a very important role in chromatin organization and transcriptional regulation. And again, they interact with very similar proteins as for HP1 family proteins, and also they form what has been very recently defined as a CHAMP1 complex, so involving CHAMP1, POGZ, and HP1 alpha. And finally, for DNA damage repair, again, they interact directly and also indirectly through different molecules like Rev7 to promote homology-directed repair of double-strand breaks. So what happens when one of the two proteins is disrupted? We have loss of functioning in one of those functioning, or maybe in all of those functioning, and this leads to reduced neural progenitor survival and differentiation and maturation of neuronal progenitor, but also an alteration in gene expression, especially for genes involved in, again, neurodevelopment or synapses function. And we can also see DNA damage accumulation, which eventually could lead to clinical signs as microcephaly, intellectual disability, or behavioral anomalies as seen in both syndromes. That's just a very quick bibliography for the slide before, which, however, helped me to show how in the last years there has been emerging interest in studying the two proteins together, because there's emerging evidence of the two proteins actually interacting. And I think this has surged also the interest in studying the two conditions together, But if we have many molecular studies for this, we're totally lacking phenotypical and clinical study that consider CHAMP1 and POGZ for a comparative work. So considered all this and taking into account the hypothesis that a disruption in one of the two proteins can lead to loss of interaction between them and downstream to an altered cellular function, altered cellular also structure, and then eventually to a very similar and overlapping phenotype. So considering all this, our work, the primary aim of our work is to deeply investigate if there could be any clinical or laboratory or instrumental correlation between the two conditions. And by doing so, we started by comparing two cohorts of patients. The first one involved 21 subjects with disruptive variants in CHAMP1 with a data set that was collected and made available by Professor Zollino in Rome. And the second cohort involved 20 subjects with pathogenic variants in POGZ that was collected at our institute in Trieste. So based on available data, we compared the frequency of different signs and symptoms in those main macro areas, so of neurodevelopment and behavior, but also neurology and anthropometric measures, presence of dysmorphism, both facial or skeletal, and then ophthalmology, gastroenterology, history of respiratory infection, and prenatal findings. So we used a Fisher test to evaluate whether the two cohorts could be comparable or whether there was any significant difference between the two. For this first work, we considered the presence of the frequency, so the presence of a given sign or symptom, except for intellectual disability, where we also considered the severity of the sign. So what we can say is that there was not significant difference between the two cohorts in all macro areas considered, except for hypotonia and gastrointestinal issues, where it seems that the CHAMP1 cohort had higher prevalence of symptoms. However, we also went through revision of literature for POGZ, so for White Satin syndrome patients, and it appeared that also in our cohort, the frequency of gastrointestinal issues and hypotonia was lower than what has been reported worldwide. So this could be a first bias of the study. Another, as we can see, another significant difference is in the severity of intellectual disability, where it looks like that CHAMP1 patients present with a more moderate or severe phenotype. However, as said, this is an ongoing study. That's just a very first stage of the study. So the aim for the future is, of course, to deepen the phenotyping work, both expanding the area, what we call macro area, so the area of the sign and symptom that we considered, but also the severity of a given symptoms. And we can do so by using standardized scales to compare the severity of the two syndromes. What we can do is also to conduct subgroups analysis, so divide the patients by age or by type of mutations. This could also help with a genotype-phenotype correlation study. And then, of course, as I said before, it would be very helpful to conduct a systematic review of the clinical data present in literature so that we can have a clearer idea of the actual frequencies of the given symptoms in the two cohorts. Then, as regard molecular aspect, we aim to conduct also epigenetic analysis to study the epigenetic signature of the two syndromes and to compare them. And by doing so, we're being helped by Dr. Tartaglia from Ospedale Bambino Gesù in Rome. And then finally, of course, one of the outcomes of this study would be to investigate the possibility of common therapeutic strategies for the two syndromes. Professor Gasparini is going to talk about it very soon. I just given a bit of a spoiler of it, but in our institute in Trieste, we're conducting a drug repurposing clinical trial on White Sutton syndrome patients to treat some of the behavioral aspect of the syndromes. And if the biological plausibility is confirmed, so if we can consider the two conditions as part of the same family, then it will be also open the possibility to treat a CHAMP1 patient in the clinical trial. However, yes, as I said, that's the very first stage, and we also wanted to take advantage of this conference and this gathering of many different people working on the same field. So any discussion and suggestion and anything is welcome. Thank you for your attention.
Thank you very much. Thank you very much. Well, let's start.
Anna, really, really great talk. I'm curious, and maybe this is just like a writ large question for like the other clinicians in the room as well. As it relates to the GI issues for the CHAMPs, is there any clarity on if that's some sort of disruption in the GI system in its own right? Is there like a gut-brain axis aspect to it? Is it fully neurological or any mix of the?
It's not clear.
Okay.
It's not clear neither for CHAMP1, neither for White Sutton syndrome. There has been different hypotheses, but definitely not clear.
Cool. Okay. Thanks.
And also the kind of symptoms are quite varied because we have cyclic vomiting, but also constipation, vomiting, not cycling vomiting, just vomiting, difficulties in feeding. So it's very, yeah.
Are there any other questions? No? Okay, thank you very much.